Thank you for joining us this evening for the second Parent Information Session. My name is Casey Akar. I'm the Chief Executive Officer of the National Parenting Support Commission, and we're an agency of the Ministry of Education, Youth and Information. With me are some specially invited persons who will be here to not just to give you information, but will also be here to listen to the questions that you may have to provide you with answers. The information session is geared towards ensuring that you have a fulsome understanding of the plans for your children for September and to give you the kind of reassurances so that you can make sufficient plans for your children. So to my right is Dr. Cassandra Troop. She is the Acting Chief Education Officer in the Ministry of Education, Youth and Information. And to my left is Dr. Tamika Benjamin. Dr. Benjamin is the National Mathematics Coordinator, and she also serves as the Tertiary Support Officer here at the Ministry of Education. Later on, I will introduce Mrs. Mitzi Harris Dillon, and she's the interim president of the National Parent Teachers Association of Jamaica. Thank you so very much for joining us. You would have been told previously that we would have had 6 of these parenting information sessions, 1 per region. Well, as you know, that did not work out according to plan, and we listened to you, and so we have modified, and here we are having this mass session with you this afternoon with a view to have another one this Saturday. So welcome everyone. We're here to support parents. I just want to talk to you a little bit about the National Parenting Support Commission, who we are, why we're here, and then we'll have the other persons who are here present. So the National Parenting Support Commission, as I mentioned before, is an agency of the Ministry of Education, Youth and Information. And as the name suggests, we're here to support. We actually advocate on behalf of parents. We're non-regulatory. It means that there's no punitive anything. We don't punish parents for anything. What we do, we use education, we use research, we try to communicate in a way that everybody will understand. And we aim to give all the kinds of support that parents need so that they can be great participants in this process we call education. We firmly believe that if parents partner with us, then the outcomes in terms of your children's achievements will be better. So we implement the National Parenting Support Policy, which essentially says that if you promote the interests of your children, if you provide them with resources, if you ensure that they're safe, if you love and protect them, if you do all these things, parents, then your children will be great citizens. And essentially, that's what the Ministry of Education aims to do. We want to make sure we're giving your children all the proper education and give them all the right tools so that they can be the best citizens to contribute to this great land we call Jamaica. And so here we are, National Parenting Support Commission. We coordinate resources to ensure that parents remain active participants in the process that we call education. And so let me move on, because I know you really don't want to hear from me. You're here to listen to the plans for September so that you can not only make decisions that will be in the best interest of your children, but that you too can feel comfortable. I know you all have anxieties. I'm a parent too, and I too have my concerns, but because we're all in this together, here we are this afternoon. So then, I am going to introduce, as I had done before, I'm going to just give the mic to Dr. Tamika Benjamin, just to say a few words so you know what her voice sounds like, and then we will move on to Mrs. Dillon, who will come, and then we'll get to Dr. Troop.
Good afternoon, everyone. Thank you, Ms. Carr, Dr. Troop. So I, as Tertiary Support Officer, the main role I provide in the Office of the Permanent Secretary is to support the ministry's efforts to improve how we work with our tertiary institutions. And so I hope today I can provide guidance for those persons whose students may be transitioning from the secondary level into the tertiary level of the system, or who are at the tertiary level and are unsure what are the plans for the new school year.
Yes, and Dr. Benjamin, because we're we have to make sure we're maintaining social distance, even as we broadcast to you. I'm going to ask you to just slip to the left, and then we'll invite Mrs. Dillon to come and greet everybody. The National Parent Teachers Association of Jamaica is a great partner of the National Parenting Support Commission, and by extension, the Ministry of Education, Youth and Information. And so it's important that the NPTAJ has their say as we ensure all parents are fully supported for back to school. Mrs. Dillon.
Good evening, Jamaica. Good evening, parents, teachers, principals, board chairmen, administrators, everyone. Today marks the second in the series of parent engagement sessions that the ministry has so kindly engaged with us, the National Parent Teachers Association of Jamaica, in bringing to you to give you a better understanding of the preparations that are in place for back to school come September. Allow me first to recognize the presence of the CEO of the National Parenting Support Commission, Ms. Keisha Carr, Dr. Kassan Troop, Acting CEO in the Ministry of Education, Youth and Information, and Dr. Tamika Benjamin, the National Mathematics Coordinator in the Ministry of Education, Youth and Information. All of the distinguished guests here present. Special commendations to our administrative and ancillary staff in all our schools. We have to give them a shout out because without you, so much of what happens in schools would not be possible. Allow me to also acknowledge the members of our national and regional executives. Mr. Donovan Main, General Secretary, Mrs. Pauline Steele-Davis, VP Training and Development, Mr. Ray Wong, VP Finance and Administration, Mr. Stuart Jacobs, VP Membership and Field Services, Mr. Everton Hannum, our immediate past president, Ms. Carolyn Sinclair, Public Relations Officer, Ms. Latoya Benjamin, our Assistant Public Relations Officer, and our 6 regional chairmen, most of whom are women, and we have the one thorn among the roses, Mr. Lawrence Rose from Region 6. Let me share a little bit of our history and background. So the association, the National Parent Teacher Association of Jamaica, is a non-profit organization that was born on July 14, 2006, as a partnership between the Ministry of Education, Youth and Information, and the parents of Jamaica. We support the vision for education, and it is our mandate to engage our parents within the local PTA bodies across the island, ensuring that we participate as much as possible in the education system. We are the only non-governmental organization in Jamaica that represents both parents and teachers, and we are a fully voluntary organization of committed and dedicated volunteers. We are self-supporting in our functions, and it's mainly through the membership dues that our member schools and participating PTAs provide, and sometimes it's coming from our own pockets. But we have a mission, and we work very closely with the Ministry of Education, Youth and Information in ensuring that the voices of our parents are heard and that the information that the ministry has is fed through to you. We have events and activities that take place throughout the year, and Region 1 will be having some parent PTA training and workshop coming up later on this month, August 22. That's for our PTA executives in Region 1. And in November of this year, we will be having our annual general meeting and parent conference the last Saturday in November, and more information will follow on that. We're all familiar with the COVID-19, the virus which landed on our shores in March this year, and the virtual and immediate transition that took place. And we have survived. A lot of modifications had to take place to ensure that we reached our parents and our students were educated as best as possible. And we know that many were without access to virtual spaces. And there were arrangements made with many schools in collaboration with PTAs to ensure that at least documented information was transferred to our students as best as possible and through other media as well. As we are approaching back to school for September in this year, the ministry had shared with us last month about their plans, a very comprehensive plan. So many pages of information involving all the protocols that would be needed for us to get back to some level of normalcy, to bring back the one-on-one, the face-to-face engagement with our children. But it calls for us as parents to ensure that we listen carefully to the plans that are in place, and also to ensure that all the protocols, education protocols, health protocols, are observed and maintained to protect our children as best as possible. We are monitoring the situation regarding the increase in numbers of the cases over the past couple of days. But with your help, our parents, very important stakeholders in the education system, we can ensure that we adhere to all the rules and regulations, the protocols that have been established, and ensuring that we get off to a smooth start come September. But allow me now to hand back over to Ms. Carr, who will take us through the rest of the proceedings. Thank you.
Thank you so much, Mrs. Dillon. And that was the interim president of the National Parent Teachers Association of Jamaica. I am just going to quickly turn over to Dr. Kassan Troop, who is the acting chief education officer, to give you the updates for primary and secondary school. Please listen carefully, parents, because she has quite a bit of information. And I'm sure you want to hear from the source so that you're able to make the right decisions for your children. So, Dr. Troop.
Thank you so much, Ms. Carr. I'd like to greet other members of the team. Good to see you, Interim President. We continue to have our conversations. And Dr. Benjamin, pleased to see you as we continue in service to our nation. Good evening to our parents. We are so happy to know that you have logged on, you are following us, you are in the conversation, and we are just setting aside this opportunity to update you on the many plans that we have for you and your children. But you know this can't work without you, and so we want you to be fully aware of the consultations that we have been having and the plans that we have developed with you in mind for your children. And so this evening, as Ms. Carr said, is set aside to share more details with you. I am proud to say that we had one session already and it was oversubscribed, and so we had to go back to the drawing board, and now JIS is with us, making sure that everybody is able to log on this evening and to follow the conversation. So you would have heard from our first interface parents that we have done a series of consultations with our key stakeholders in the education sector, our board chairmen, our principals, our vice principals, our teachers, our international development partners. We could not have left them out of it because this is a global situation, and so we wanted to learn from best practices. So we have had conversations with our international community and all our local associations, our principal association, our independent school association, all our key partners. We have been having a series of conversations because we understand this is unprecedented times. We don't have the rubric, we don't have the framework. There is nothing laid down for us, so we are learning as we go. And so we have to dialogue and to build and learn from our expertise on the ground. And out of that, we have had a number of plans coming out, having key conversations with our principals, with the Ministry of Health. You know, we are really in a health crisis, and this is what has been impacting on the education system. And so we had to make sure that we continued the conversation constantly with the Ministry of Health. And so the plans that we have is informed by the health precautions that we have to observe. There are no compromises as we try to make sure that your students are safe and that when they come home to you, you continue to be safe as we work together to protect all of us in this country. So come September 7th, we will have the reopening of our schools, and we would have learned from the partial reopening that we had in June for our exam students. So high school principals would have shared their challenges with us, and so that kind of information was used to inform the plans going forward. So you would have heard by now that the Ministry of Education would have approved the schedules of curriculum implementation for our schools, which means that our principals have audited their schools, they have looked at what are the limitations in terms of their infrastructure, in terms of their ICT, in terms of their human resource, and they would have put a plan together to say this is how school will look for September. And the Ministry of Education would have approved those plans and would have indicated that we will provide some resources for them to make sure that we have smooth operation come September and that no child will be left behind. So yes, we would have told our principals, and you would have heard by now if you are participating in your local discussions, that some schools will operate normally. So we have in excess of 900 schools, public schools in Jamaica. And in my initial conversation with some of our parents from Region 1, we would have indicated at the time that 411 schools will operate their normal school operation. Since then, we have gone back to the drawing board because, as I have said to many of my parents, that our thrust really is to have more face-to-face engagement, to have more of our children in our schools in light of the supervisory challenges that some parents will have. And so this evening, I would like to update our nation, our parents, that we have now 569 schools that are able to operate normally. So it means that everybody will be in the same space every day. And of course, we have to observe the physical distancing. So with the infrastructure that we have in place in these institutions, they will be able to accommodate their fully enrolled students. And some of these schools will get what we call temporary learning spaces via tent or via rental agreements with nearby institutions such as our churches or those that have conference halls or so forth. So 569 of our schools, and we have approximately 303 of our schools that will operate what we call the rotational model. And the rotational model, parents, really means that some days some students will operate in the virtual space from home, and while others are at school. And then those students who will be at home on one day will come back into the physical school another day, and other students will work from home. So that's what we call the rotational approach. Because of the limitations of the physical infrastructure, some schools have opted to operate in this way. And these schools are our large, very large high schools and our very large primary schools, because it would be very difficult, parents, to keep everybody in the same space and to keep them safe at the same time. And so, yes, you would have heard about the rotational approach, which means some will be in, some will be out. Of course, we have seen a number of parents wanting to have homeschooling, and so we have a homeschooling framework in place, which is monitored by our independent schools unit. And so parents who are interested can apply through our independent schools unit at isu@moey.gov.jm. And we will provide you with the guidelines, and of course we will support you through this process if you are so interested in this approach. We have the extended day model as well, where some schools will have our children coming in from 8 o'clock to about 2:30, and others will join from 10 o'clock to about 3:30. So it's a staggered shift in a sense, and that will avail some physical space. And so persons can be kept safe in the environment, both teachers and staff members, as we manage that kind of schedule. The extended day approach, parents, is not really new. There are many schools that we have who operate this normally under the normal circumstances. But we have more schools now using this framework so we can manage the use of the space to keep everyone safe. And you would have heard that some of our high schools, with regards to our grades 12 and 13 students, will be operating the online modality, where they are migrating to the online space for most of the engagement. Very few schools would have opted for that, but it's a part of the curriculum implementation schedule that we would have approved at the ministry. And all of these schedules, parents, will include the delivery of a blended learning approach. And what do we mean by that? It means that the learning engagements will include face-to-face, where children are in the classroom. It will also include the e-learning or computer-aided lessons. It will also include our televised learning program. Yes, parents, the Ministry of Education has procured their own e-home TV network, and we are building out the learning programs and recording the lessons to complement the teaching and learning program for September. So students will be told to watch a particular television station at a particular time, and we have partnered with the cable network to have these stations available on the network as part of the partnership. And you will be given a schedule that will be shared to say what topic will be dealt with, what time. Teachers are able to integrate that in their lessons and also to follow up on that to ensure that there's teaching and learning taking place. And of course, there are some students who will be challenged. They may not have the devices, and so we will continue to provide our printing, or what we call our learning kits, which is really inclusive of printed materials, our workbooks, our textbooks, all that kind of support, our handouts will be made available to support our children as they try to ensure that the learning episodes are not compromised. And we're also able to tell you today that we have completed our Ministry of Education content app. So we have an application now available, and this application will be available to all our students, those students who will be providing technological support for, and those students who will bring their own device. And the beauty about this app is that the students are able to access the learning materials without the internet. So we started developing this app for quite some time, but of course with the challenges that we observed during the emergency remote teaching, we had to make sure that our application would be able to provide access to learning materials without data. And I'm proud to report to you parents that that is now available, and the textbooks can be accessed through this, our e-resources can be accessed through this, and we have downloaded over 83 different learning applications that will be made available. Our teachers will become familiar with these and will plan these in the learning episodes. So those who are working from home, they'll be able to access the materials offline and continue as they come back to school for the follow-up discussion. So we have been listening, and we have been trying very hard to make sure that nobody's left behind. I'm proud to report to you parents that all our students will be assessed coming back to school. I know you're concerned about the learning lapse that would have taken place and the learning loss that some persons would have articulated as a major concern because some persons were not fully engaged during the remote teaching. So what we will be doing this year, when we resume, we'll be supporting our teachers to conduct or to administer the assessment diagnostic instruments for our grade 1s to grade 9 students. And the school principals at the secondary level for grades 10 to 13 will develop those assessment instruments at the school level, and we will support them in the administration process. We will also assist our schools in marking and analyzing the data so we can develop the individual learning plans and the remedial programs that will be required to get the students back on their learning path. That kind of support will be provided for September. So this, I'm going to break now at this point, Ms. Carr, and so we can discuss some more. We have a lot more in store for you in terms of books that we are providing for the system, in terms of ICT support that we are providing for the system, but I don't want to hog the show too much. And so parents, we are here for any kind of questions that you'd like to hear. And of course, in terms of the phase resumption, you would have heard about that, and I know some of you are concerned about that. We would have indicated that as per usual, school opens on the first Monday in September. This is codal, right? And so the 7th of September, our official learning program will begin. But you would have heard from some of your principals that you will engage in activities prior to the 7th. So we have given permission for that. So if a school is prepared to have its orientation program or the simulation exercise prior to the 7th, we have given approval for that. If the school is adequately advanced in their curriculum planning, in their training of teachers, and they are bringing these persons in earlier than the 7th, we will support that. And parents, this is not new. Schools have normally done this over the years as they prepare for the learning engagement. And so we have been flexible. What we put out there is just a guide, and the guide is available to all our private institutions as well. They will not stick slavish to it. I've seen questions from our parents coming in about our private schools. They use this also as a guide but they will be guided more fulsome by their limitations on the ground. What is it that they can accommodate within their learning environment to make sure that everyone is safe? So the phased approach is there. It's a guide, and our principals will communicate to you directly with the specificities per school, because we know that there are different nuances on the ground, and the model will allow for the flexibility. So we're asking our parents to be considerate and not to challenge our principals when they say we want the students a little earlier than what the ministry would have indicated. Thank you.
And thank you to Dr. Troop. May I remind parents that we expect you to send in your questions. That's one of the reasons we're here, to make sure that you have the answers directly from the source. So I'm encouraging you to send in your questions, write them on the GIS social media platforms and also the ministry's platforms. We have persons who will alert me to your questions, and we'll try to answer as many of them as possible. We aim to be here for 2 hours. We have already expended 30 minutes, so we have an hour and a half to go, and we'll take as many questions as possible. I want to now invite Dr. Benjamin to just speak a little about the plans for our colleges and universities.
Good evening again, everyone. So at the tertiary level, we have been engaging the tertiary institutions in a number of consultation sessions. And there are just 4 areas that I would want to cover in terms of providing an update. In terms of start times, most of the tertiary institutions will resume as per usual towards the end of August with their returning students. As we know, our grade 11 and grade 12, 13 students would have just completed or just about be completing their CSEC CAPE examinations. And the results from those examinations will therefore be available much later than normal. And so the institutions have agreed to delay the start for incoming students, new students, and so they will not be disenfranchised. In a number of instances, they will rework the academic calendar. My apologies. They'll rework the academic calendar to allow teaching to go on into December and then do their end of semester examinations in January. And that will apply to the new students. The regular calendar will apply to the returning students. As with the models that Dr. Troop would have described for the primary and secondary levels of the system, various institutions will apply similar models, again, depending on their capabilities and locations, because some institutions are in deep rural areas where they have limited internet access as well. So there will be some sort of rotational model. Some institutions are opting to allow face-to-face on the campus for the students who have challenges with the technology and with accessing the internet. And those that are able to function online will be allowed to do so fully. Some will provide a mixture of both face-to-face and online, depending on the course content. So some courses which have practical elements to it, students will be required to come in controlled groups for those classes, but will do face-to-face otherwise. So again, the important thing is for our students and parents to begin to interrogate what the plans are in each institution and for each program, because it may vary based on programs and based on years. For instance, I know with our teachers' colleges this year, where the students will be going out for teaching practice, some institutions are making various arrangements based on their program design and the needs of their students. Another conversation that needs to start now as well is that relating to boarding. Clearly, there is going to be a challenge when it relates to maintaining the physical distancing guidelines. And some institutions have already indicated that their capacity for boarding will be reduced in the upcoming academic year. It's therefore important that students who would have normally accessed boarding begin to communicate with their institutions, ensure that they know what processes will be used to determine, and they know what space will be provided. So this is another area that I believe, again, will vary. I know one institution has already gone out to the public to identify spaces that can be made available privately for its students, but it's going to be important for each student to determine what will be available at that institution, particularly if you already travel significant distances to get to school. And then the last point I will raise, which is not necessarily related to the institutions, but related to the ministry's support for tertiary, a number of students would have applied to the Ministry of Education, Youth and Information for scholarships and grants. And this is the time of the year where we would be moving into interviews for this. We are currently in dialogue to determine how we will facilitate this process safely. We recognize that many of the applicants would probably face challenges if we required them to access the interviews online. So we are looking at a possibility, not the possibility, we're moving towards a model where students will be engaged in a physical space where the technology will be provided, but the interview panels, the members of the interview panel will be brought into the space virtually so that we can maintain the required social distancing guidelines. Those interviews will begin next week, Monday, for scholarship applicants, and we expect that between now and the end of the week, we will begin to make contact with students who are successfully shortlisted. We will start processing the students who applied for the tertiary grants within the next 2 weeks. And again, we will try and ensure that the processes will be clearly communicated so that students who are waiting updates from the ministry will know what's going to happen. The processes for the grants may be a little different from the processes from the scholarships, because this year, Dr. Troop, we had more than 6,000 applicants. And so we will have to come up with a mechanism to manage that process safely within the timelines. We know that a lot of students are waiting the results of this, so they will know whether they can advance, whether they'll be able to take on the programs that they would have been accepted for. And so we invite you to maintain as much contact. We will make sure the information is made readily available so that you know what is happening next.
Thank you so much, Dr. Benjamin. So you would have heard quite a bit, and the questions are already coming in. So Dr. Troop, you'd have had a moment to rest your voice. So the first question is yours, and it relates to grade 7. Has the book list for grade 7 students been communicated to schools?
Yes, as it relates to our book list, we have a protocol in the Ministry of Education, parents, where annually our school principals are asked to submit the recommended book list from at the school level. Those book lists, they are reviewed at the regional level and against an approved standard, which means that there are some books that the Ministry of Education would have reviewed to see how they align with our national standards curriculum, and those books would be approved for our textbook loan program and also for our supplemental list. Notwithstanding that, we didn't leave it to chance. We asked all our institutions to submit their book list. We reviewed it according to the standard. Our media services unit team would have done so, and then feedback would have been provided to each school concerning their book list as it relates to what should stay, what should be removed, what can be categorized as supplemental or so forth. And then that information was sent back to our principals to provide guidance as to the final approved book list, and then that would have been circulated in your registration packages. So the registration packages that you got at your new school when you arrived upon receiving your PEP results, you would have seen your book list in that, and for the returning students, you would have seen your book list in your report packages that are normally sent out with by our principals at the end of each term. Ms. Carr, I think a question came in earlier also about our early childhood institutions. So when I spoke of the resumption plan for our schools, it would also impact our early childhood institutions. As I said, all schools normally would commence the first Monday in September annually, and so our ECIs and our basic schools, our infant schools, they will also commence in September 7th. They will also experience their simulation week activities to make sure that our babies are sensitized and their parents are sensitized and the staff members are sensitized as to the protocols. Our babies are a little different. The groupings are smaller. I think for the children 0 to 12 months, we have indicated in our bulletin that was released today for the early childhood institution that they will be grouped 1 to 5, so 5 children to 1 adult, to make sure that all will be safe. For our babies 13 months to 35 months, the grouping is 1 adult to 8 children. And for the 3-year-old to 5-year-old, the grouping is 1 adult to 10 children. We also sent out into the bulletin today the guidelines as to how to make sure that the resources that are assigned to a particular group of students is limited to them, and also the materials that our parents should take with our babies to the institution to make sure that the things are not being shared. All of that information was sent out today, so I'm encouraging our parents and teachers of those levels to get in touch with our institutions. The bulletin will also be uploaded to our website, so you can access that information on our website. We're really asking our parents to support the ECIs. Our children are just as vulnerable. And so you will see in the bulletin that the Early Childhood Commission would have recommended that parents are not necessarily allowed onto the compound, but there will be a protocols worked out where students will be picked up and dropped off to make sure that we don't have the adults coming in into the space for the babies, because they have to keep them safe. So you will see some specific guidelines, and also a protocol document developed by the ECC was sent out today to talk about diaper changes and how we sanitize our teaching aids and so forth. So all of those guidelines were released today for our babies. And of course, the Ministry of Health would have said to us that the 0 to 2-year-olds should not wear the mask. And so the physical distancing is extremely important for our babies, and we have to manage now the persons who are coming into the environment, because our babies will not be in the mask. Of course, you know, the 3 to 5-year-olds, it will also be difficult to get them to keep the mask on. So monitoring is going to be key, which is why we are saying the adults, 1 adult to 10 children, 1 adult to 5, 1 adult to 8. So we are limiting the number so the monitoring can be more effective, and of course we can maintain the physical spacing. We have also given ideas in the bulletin as to the grouping, so we can manage the grouping and the timetabling, so students who are inside remain in and those who are out, and we rotate that so we can share the space and keep our babies safe. But the institutions all will be open on September 7th, and they also will be communicating to you their phased resumption activities guided by the guidelines we sent out today.
Thank you, Dr. Troop. Well, there's no time to rest, because here's another question for you. For the over 500 schools that will have full-on school, have all considerations outside of the classroom space been examined? For example, canteen, bathroom, etc. How will we ensure playgrounds? How will we ensure that children remain socially distanced in those places?
Parents, you know, the physical distancing will be a challenge no matter what. I can tell you, our principals from the high schools would have communicated to us from the reopening activity that we had on June 8th to July 3rd. The most difficult of the task was to keep the teenagers apart. And we don't anticipate that it's going to get any easier come September. So what we would have done is to make sure that all our school staff, with the Ministry of Health, we have trained over 13,000 school staff members at different schools right across this country to make sure that the knowledge and the skill set reside in each school to protect everybody in that school. So our deans of disciplines, our nurses, our guidance counselors, our vice principals, our bursars, they have all been exposed to intense training from the Ministry of Health to make sure that they can set up and apply these protocols, and also to make sure that these protocols are constantly observed. I cannot sit here and tell you that it's going to be easy. We are a loving people. We like to touch. We like to play. And so this is going to be a very difficult task. but we have also committed to provide additional human resources in the facility. And that is why timetabling is key. We are relying on our principals to make sure that everybody is not outside at the same time. The principals have put in systems in place to manage even the lunch hour. Not everybody will be released at the same time for lunch. They are putting in systems in place that the lunch probably will be brought to these children. So a number of things are happening as it relates to the planning. And that is why we started the conversation so early, because everything has to be looked at. How we come into the environment, the temperature checks, that's also a protocol that there's no compromise on that, and that is going to be even difficult when you look at a school that has 2,000 children. And that is why some principals would have opted for the rotational model, because to manage that on any given day is very difficult. And so I can't sit here and tell you it's going to be easy, but what I can tell you is that we have trained the school staff. We have made sure that the capacity relies at the school level. The Ministry of Health has said to us we will provide announced and unannounced visits. The Ministry of Health has said to us that their parish teams are available to provide guidance and support. They would have indicated the need for the isolation areas. We would have sent to our schools additional funding to install the wash stations and to procure the sanitizers and the temperature check devices. We have done all of that, and so we just have to keep trying, and we ask you parents to make sure that your children are protected and that they practice the safety precautions. As we return to school, they will be interacting, they'll be seeing their friends, but you also have to get into the conversations with them to help them to understand that while we are social beings, we have to practice the physical distancing now to keep everybody safe. It's a discipline. It's really a discipline right now, and it's a partnership. There's no perfect way to say it, but we all have to play our part. So parents, even the preparation for the mask and so while schools will have emergency kits and have materials available, our parents have to make sure that our children, their own children, are equipped with the necessary resources, a little bottle of hand sanitizer, a little soap, of course their mask. The mask is mandatory from the management period under the Disaster Risk Management Act. That's mandatory for our country. So everybody should be wearing a mask in the public space. So whilst you prepare your children, you're preparing them with their masks so they can have that in the school spaces, and that they are practicing the safety precaution. Parents, I don't know how else to say it, we all have to play our part in this area.
And that should be reiterated by the National Parenting Support Commission and the National Parent Teachers Association of Jamaica. The onus is also on parents to ensure that you're talking to your children about what it means to remain safe, I beg your pardon, at this particular time. So you can't repeat the safety precautions as outlined enough. You have to make sure you're reminding our children, who we all love, we all care for them, we all want them to remain protected. You have to just repeat every day what those safety precautions are. And you too should model what they look like, because that also helps to reinforce. If they see you being conscious about being socially distant, if they see you wearing your mask appropriately, washing your hands as often as you possibly can, hand sanitizing, and just having that consciousness, then it will just become a part of the way we all have to operate. So I would implore parents to ensure that you're also repeating those precautions. We don't want our children to be sick. We do understand the challenges. We're not here being idealistic at all. We know it will be challenging, but we're also saying we're here to support, and the National Parenting Support Commission stands committed to that process. You can call us at 876-967-7977, and you can contact us through the Ministry of Education, regional offices, and of course here at the head office as well. All right, so we go to another question, and this one has to do with PEP and NSC. The question reads, in what way will these measures affect PEP and the NSC curriculum?
Okay, so parents, I know you're nervous about the PEP. It's a high-stake exam for you. You would have seen what the ministry did during the pandemic in March, April, May. We were able to take a decision in the best interest of our students. The fact that we operate our own exam at that level, we have some amount of flexibility guided by the information on the ground. So when we resume school in September, our students will be going through a diagnostic period of assessment. And that information, supported by our technical officers in the field, we will analyze that information to find out the level of learning loss or the gaps that we would have anticipated. At least we'll get the specific information per child. And that information will be analyzed and will be used to determine how we modify, if any, the curriculum going forward, whether we reduce a particular area or we continue to work with the curriculum as it is outlined now. And so all the decisions that we will take concerning PEP will be an informed decision. So we will look to see what information will be coming out of the assessment. We will restructure the curriculum activities and focus area based on that information, and coming out of those learning experiences and the monitoring that will take place, if we have to adjust in terms of what the area of the exam will be focused on, we will make that adjustment. You have our assurance, parents, that we will never put our students to do an assessment activity that we have not covered the teaching engagement or the learning activity on. We will never do that to our students. We have that opportunity to modify and adjust as it relates to the exam and the questions and the focused areas based on what we know that the students will be able to cover during this period. So we are able to do that as per what we would have done. And we are relating with our psychometricians and our external partners and assessment to make sure that the best decision is taken for our students.
All right, and I just want to read a message coming from the Early Childhood Commission, because there were some questions and we continue to get questions from persons who have children who fall within that age cohort. So seating will be done according to the ECC standards of 20 square feet per child. They do recognize that social distancing for this age group will be a little difficult, and so this will be supported, meaning the social distancing policy will be supported by ensuring that activities are planned that do not involve the sharing of objects, that when possible they will move activities outside for more spacing, etc. So as soon as more updates coming from the Early Childhood Commission, I'll be happy to share those with you. And we move now to another question. And it says, what about the smaller children who have medical conditions, especially the ones in the infant department?
Okay, as it relates to our students and our teachers and our school staff, if persons are sick as it relates to their health care and what will happen in the school environment, we are guided by the Ministry of Health. As I said earlier, we're having a health crisis that is impacting on education. And under the Disaster Risk Management Act and the instructions that we have been using to guide Jamaica, it would have indicated that if persons are sick, they are to stay at home. They have to stay at home, parents. I know you might be a little scared and you don't want them to miss out, but if they are sick, especially with the flu-like symptoms and so, they have to stay at home until they get well. If persons have those symptoms at the school level, they will be isolated and they will be recommended for medical care. Those children who have the pre-existing conditions that would have been outlined, like the diabetes, those adults with the hypertension and so, the guidelines under the Disaster Risk Management Act will also take effect, that those persons will be facilitated to work remotely. And so we will provide the support for that. If students have to learn remotely, we will provide the scaffolds and the enablement for that. Whatever learning kits that need to be home, whatever application that need to be available, whatever support that we can provide to make sure that those students are not left behind. Our principals, our regional directors have been so guided, and we will support them. We know it's a difficult time, but as the instructions would have indicated, they will have to stay home until they are better, and we will be guided by the medical practitioners in that regard.
Okay, all right, I'm scanning through. My main concern is transportation for students to and from school. So that's a statement, not a question there. And so all the protocols, we want to reiterate that we understand that some children have to travel via public transportation, but there are guidelines for public transportation, and we expect that you're going to adhere to those guidelines. As a parent, you want to make sure you supply the masks for your child, the hand sanitizers, and you want to make sure that they're not staying at the bus stops and mingling, but they're maintaining social distancing while even at the bus stop. So you want to reiterate those guidelines for your children. For students who are on PATH, will tablets be provided for them? And if so, how do I go about accessing the tablet for my child?
Okay, so for our students on PATH, you would have heard our minister articulating that we will be providing some support this year. Initially, we would have had a plan to procure 40,000 tablets. Those tablets are already here. And in collaboration with eLearning Jamaica, we are actually uploading our content materials on those tablets. And our minister would have indicated that we are procuring an additional 60,000. So for this academic year, we are providing 100,000 tablets for our students on PATH. And it is hoped that for the following academic year, we'll also support those other students who are on PATH. So yes, we will be providing that kind of support. We are targeting this year those students who are in the very deep rural areas who were affected by the lack of a device or the lack of access to internet. Those students are priority students, or students who are sitting the exit exams, the PEP and the CSEC. Those students on PATH are the priority persons that will be addressed in the first phase of the distribution. And it is hoped that we will complete that distribution by the second week, the latest in September. The tablets will be sent to the schools. We have indicated to our principals already, the students will be helped in terms of the criteria. They would have looked at their data at the school level, and they would have sent to us a list of those students that they will recommend. Those students that they couldn't reach during the emergency remote period, and they are on PATH, those students are priority. And so a list is already submitted from discussion with your guidance counselors and with parents, and that took place at the school level. And that information is now with us, and the tablets are being packaged accordingly. We will send them to the schools. Our parents will be called in, and you will sign for that. So the tablet it's going to be treated in the same way we do our book loan program, where you sign for the tablet, and you have to take care of the tablet, parents. The protocols will indicate that if you are negligent, there is a cost to bear. And so you have to take care of the devices. And at the end of each academic year, we ask that the device be submitted back to your principal, and we will do the servicing and the reconditioning and the upgrades of the apps and so, and then we will distribute the tablet back at the new academic year. So it is hoped that a tablet has a life, Ms. Cara, for 3 years, and it is hoped that the tablet will follow our student for a minimum of 3 years with the support of the ministry in terms of the maintenance and the servicing and so. And of course, we will hope that that the additional 109,000 students on PATH, we'll hope that we can reach those students in the second phase of the next academic year.
Okay, so I have an important question here. Not that the others weren't important, but what about the students who have parents going out to work? Who will monitor every day, going to work every day? Who will monitor those students if they're to stay at home? And I know this is a serious concern. There are some persons whose work cannot be facilitated at home. We have some persons, for example, household helpers who have to go out every day, and they might have to leave their children at home. So this is a very important question that's being asked. It's one of the reasons we really encourage the village to be a part of the whole answer for this special time. You know, we have to ensure that we find somebody who we believe is responsible and trustworthy enough, who can take care of our children and ensure that they're accessing education even while you go out. I would encourage those parents to first, though, talk to the school, because it could be that your school is actually on the full day model, because we do have over 500. We have 569 to be exact schools that will operate normally. So first find out what the model is for your school. Should it be a situation where your school is on the rotational model, meaning some days they're going to be on the physical plant accessing regular school, the regular way, and some days they're at home accessing it via different modality, whether the internet or television or whatever, then you have to look to see what care groups exist in your community. I am hoping that Jamaica will just rise to the occasion.
Yes.
I sound like a singer. Is that Sizzler? See, Jamaica, I'm very with it. I'm trusting Jamaica will rise to the occasion, and everybody will come together. This is a time when we can't just say we love our children and want to take care of them. This is a time when we all have to come together as a community to say, look, these are our children and we're going to take care of them. It calls for all hands on deck, because truthfully there are some parents whose jobs require that they go out every single day. And I know as a parent it's going to be very difficult for me to operate at my optimal if I am concerned about the safety of my child. So let us have discussions about it. Perhaps you parent, if you're the one who has this consideration at this time, you'd want to call the commission and let me sit down to see what your specific circumstances are, and let's see how we can work out a plan. I repeat, the number is 967-7977. May I also say to you that we have launched 36 helplines across this country, and they've been localized for each parish. Each parish has a set of unique numbers. Access those phone numbers and call. They will put your questions to me directly, and together I am sure we can come up with solutions for you and your children. We really don't want to hear that our children come into harm's way because of, somebody who is not able to stay at home. We don't want to hear that at all. We all bemoan the atrocities when they occur, but here's a time for us to try and prevent those atrocities from occurring. We don't want our children to be harmed. So rise up, Jamaica. Let's get involved. Let us ensure that all our children are protected. All right? There are solutions, I believe. Okay. Now, with that said, will basic schools reopen come September? I think we answered that, and we said
all
yes.
our ECIs will be open on September 7th, and they will also have their simulation activities and their phase resumptions and their training and their protocols. So we're asking our parents to get involved, get in touch with your teachers. They are preparing, they have been trained. The ECC sector has been trained as well by the Ministry of Health, and so they are fully seized on the activities that should happen on the ground.
And here's a question for you. Will members of the Ministry of Education, Youth and Information be visiting kindergarten schools?
If the ministry?
Yes, will we be visiting?
Yes, our early childhood sector has the development officers who will be visiting, and of course each ECI is in a quality education circle that is supervised by an education officer, so they will also be visiting. In addition to the supervisory officers, we have our curriculum specialists. They also will be visiting. So yes, you will get the support from our technical officers. We have our safety and security in schools unit. They also will be in the field, making sure that all is well for our students.
What about face shields? Could those be used instead of masks?
The Ministry of Health parents would have indicated that the face shields are actually complementary, but they cannot replace the mask. The mask is the best. You may be able to use it in addition to the mask, but it will not be recommended to replace the mask. The mask is what the Ministry of Health has said that must be worn. The face shield can be complementary, but will not replace the mask.
Right. And to those persons who are asking about the website for homeschooling, for those parents who are interested in having their children homeschooled, so the email is isu@moey.gov.jm, isu@moey.gov.jm. Those are the sites. Of course, we have Dr. Tamika Benjamin here with us, who will support your questions with, I'm sure we'll find the answers for those children who have to go to our colleges and universities come September. I know you too have concerns, so please don't be afraid to send in your questions. We'll try to answer. And where we don't have the answers, we'll certainly find them and get back to you. How about school fees? Do PATH students Well, let me fix that. Are PATH students required to pay school fees?
Okay, parents, as you're aware, we have a non-mandatory fee policy in the Ministry of Education. This is very important. And so no child is supposed to be denied access because of the parent's inability to find or be able to provide the contribution. So what your principals have asked you to give, they may give you a voucher in the registration package or so. It's a contribution to complement the budget that they will have to operate their schools. However, it is not mandatory, but what we have said at the Ministry of Education, if you are able to provide any kind of support to your institution, we encourage it. But we have said to our principals that if a parent is unable, that child should not be denied of any service related to education. Education is a right of every single Jamaican child, and we have provided the grants to our schools for them to operate. But many of our schools' parents, they have enrichment programs, they have expanded their curriculum, the clubs and societies, there are many based on your interests and the interests of your students and children. And so sometimes that will incur additional cost, especially the competitive sporting programs. You know them, and you know how important that is to win a particular title. That will come with some additional demands. And so what you would have had in your package is a request for a contribution. And whatever portion of that you can give, we encourage it, but it is not mandatory. No child should be denied. Our past parents, if they are able to, they can. But if they are not able to, it is not compulsory.
Okay, and another question here now. And I want both of you to answer. So Dr. Troop and Dr. Benjamin, I want Dr. Benjamin's response as well. So if the new app will have learning materials, why do we need textbooks?
So we are phasing out the textbook, parents. I know you're going to come with that. You're with the technology. And so we have e-resources. And for this year, we are starting with our high schools. So some of our high schools, our students will be benefiting from the e-text, what we call flat books. We are discussing with the Book Industry Association of Jamaica. You can imagine that they too need some time to transition. They would have had their books printed already and their model set up already. So they too need some time. So we are in negotiation with them, and we have committed to providing some e-books this year for the high school system, and then we will continue to transition into that phase going forward.
And Dr. Benjamin, why do we still need math textbooks?
Well, my response to that might be a little strange, but not every student is going to adapt to the resource on a device. I know I struggle to read from a device. I tend to print documents if I need to do any kind of reading, and some students need to make their jottings and so on. So I think what's going to be important is knowing your child and making the decision that is best for your child.
Great answers. And so I just want to throw in a few helpline numbers. For St. Anne, one of the numbers is 788-5468. The other for St. Anne is 560-9634. So I've given two numbers for St. Anne, 788-5468, and another is 560-9634. And I'm going to just randomly select. Let me select Clarendon, 560-9209, and 788-5201. Again, 560-9209, 788-5201. We also provide psychosocial support, parents. So if you're still feeling stressed, if you're feeling overwhelmed, if you just want somebody to talk to help you to find the solutions for September and beyond, please call our helpline numbers. They were established particularly to support you. So call the helplines. Make sure you're accessing them. All right, let me get back to the questions. Yes, Dr. Benjamin, I know what you mean when you have to read from these things. Yes, so what about physical education?
Okay. Good question. So, our parents, I know some of you are nervous as it relates to the physical education and competitive sport. But in partnership with the Ministry of Health, they have said to us that we should not compromise on our physical activities. So our students should be engaged in physical activities. So that will still be a part of the curriculum activities. We just have to provide the guidance as it relates to the physical distancing, as it relates to the equipment that they are using, limited numbers of students being exposed to a particular equipment at a particular time. The sanitization routine should be engaged to make sure that persons are kept safe. So in the same way that we have the guidelines for ECIs and the same way that we have the guidelines for normal operations, we will have guidelines in the physical education classes and also of our competitive sports. We have started a consultation with ISA already concerning those, and we have provided some draft guidelines. So those will be circulated very soon because we want to make sure that we cover every area. But the Ministry of Health has said the physical activities should remain. We just have to observe the physical distancing and the health precautions.
Okay, and here's a question again. While it is a standard operating procedure for all children resuming or starting school to do a medical, will this now include a COVID test?
Well, our general medical would not include the COVID test unless the medical practitioner would have recommended such. So this is, as I said, a health crisis. We are guided by our health practitioners. The medical that you would have seen the form for, that's a general medical that is done to make sure that our students are safe, that they are healthy, and it's something that as parents we also need to know. We take some things for granted. And so when you take your child to the medical practitioner, they get an opportunity to test their hearing, to test their eyes, and to make sure to look at their skin, to make sure that they provide some guidelines to you to ensure that the students are eating healthy, and that if they need glasses, that they will recommend that. So it is very important at every level of the transition that you get some information concerning the medical status of your children so they can be provided with the interventions early, so we can delay any further damages or any remedial care that they need. It can be offered. So it is something that we recommend, and it also covers our immunization that is required. So you may pick up when you're doing your medical that there are some gaps in the immunization process. That's when you do those vaccines. And so the medical is very important, a timely check on our health so we can all remain safe within the school environment.
How will the Ministry of Education treat with students who have missed PEP?
Okay, that is for the grades 4 and 5 students. We would have indicated that we would not require those students to sit those exams. So, grade 4 PEP, grade 5 PEP that we cancelled, we will not ask those students to sit those exams coming into the new school year. We will continue with the assessment that they will do at the current grade level. So those students from grade 4 moving to grade 5 will focus on PEP 5. So if they didn't get to do PEP 4, that will not compromise the placement going forward. And those students who move from PEP 5 to PEP 6, they're in grade 6 September, and you would have missed an assessment activity in grade 5, you will not be required to do that assessment for grade 5 in grade 6. We'll just focus on the grade 6 component, and we will rely on our psychometricians to guide us going forward for your placement at the end of grade 6.
Okay, Dr. Troop. So the incoming grade 11 students, especially the science students and other students who do other practical subjects, they will definitely face challenges with completing their SBAs. And in most cases, these are done in groups. Is there anything in place to assist teachers in their planning for these students?
Yes, so the same protocols that we have as it relates to grouping our students for the teaching and learning activities. So a normal classroom now will not see 40 students as you would have been accustomed. You may see 15 to 20 students as we observe the 3 feet to 6 feet distancing that is recommended by the Ministry of Health. So that same guideline will be applied when we are doing our practical subjects. So the use of the labs will be guided by the same framework that the Ministry of Health would have shared. So students, though they are working in groups, they have to observe the distancing. They have to have their precautions. They have to practice the hygienic practices. They have to wear their gloves. They have to wash their hands. They have to sanitize the spaces. All the implements that they're using will have to be sanitized and so forth. So the same guidelines as it relates to the classroom activities, they apply to the labs, and students will have to be kept safe, and our teachers will also utilize those same guidelines to keep themselves very, very safe in this new situation that we are trying to navigate.
Okay, Dr. Troops, I'm going to give you a few seconds just to rest your voice and ask Dr. Benjamin just to repeat two of the key points for those students who will be going to college or going to university come September. I know you parents out there, you too have concerns, and even those youngsters have concerns. So two key points.
The first one would be to make sure that you make contact with your college or you check your emails. Many institutions would have given you an email. So check to ensure what updates have been provided. Make sure you know when classes will resume. And for students who have applied and are awaiting their results, they too need to know what the start date will be as a new student. So that would be one. And the second one I think is important, and I want to stress again, is if you require boarding, you need to ensure you know what arrangements will be in place. Many institutions have indicated that the capacity for each room will be reduced to ensure that social distancing standards and guidelines can be maintained. And it therefore means that there will be some students who previously accessed boarding facilities who may not be able to do so. So it's important that you know what is available, and that if you are a student you think needs priority consideration, you communicate that to your institution earlier.
Thank you, Dr. Benjamin. Very important. All right. So will there be a list of schools that will be on rotation?
Okay, so we can provide a list of schools. We actually have the names of the schools that would have indicated to us the model that they will be operating. So that list can be provided. And if you want to get more details, your institutions that you are registered, your students are registered, will provide you also with the details. So yes, we can provide that through our bulletins and through our social media platforms and our website. We will make sure that we make a note of that, and we can share that with you. Notwithstanding that, parents, we encourage that you get in touch with your schools, and they will provide you with the specific information concerning how the curriculum will be implemented. And as Ms. Carr said earlier, if you have a special situation that the child cannot be left alone, you probably want to appeal to your principals to make sure that that child is always at school, given your particular circumstance.
All right. Are there plans in place to employ more teachers?
Yes, as it relates to human resource support in our schools, we would have indicated to our principals already that we will provide support for additional teaching staff and also support staff. We understand that this new situation will require that, given that the class size will be reduced, and we do not want our teachers to be overly deployed at any point in time. And so we would have provided guidance as it relates to the deployment schedule for our teachers, the number of sessions, even if it is that you will be straddling across the extended day. We are still maintaining your deployment allocation as per normal situation. You will probably benefit from the reduced class sizes, but we will not overly deploy our teachers, and we will provide additional funding for temporary teachers to be engaged to support the teaching and learning process.
Okay, so what about the parent who wants to help his or her child with homeschool learning, but is not on path and cannot afford the equipment?
Okay, so this is something that is a challenge for many parents. You may not be able to provide a device for your child now, But it is something that we have to budget towards, Ms. Carr. It is not something that the ministry at this point in time can say that will provide additional resources for those who are not able to procure that. There are discussions taking place in other ministries to see how support can be provided. But this is when we budget and we appeal for local support with our local partners, parents, reach out to a family member who may be able to help, reach out to a community social project, your member of parliament, all those kind of local supports that are available. We ask that you reach out to these because at this point in time, we would not be able to commit to assisting other students at this point in time. We're not saying it will never happen, but as the budget allows, we're only able to focus on the PATH students for now.
Can you tell us about government workers and not paying school fee? Parents need to know.
Okay, as I said earlier, parents, we operate a non-mandatory fee. And if it is that you would have got a voucher asking for you to contribute, it is what it is, a contribution. It is not mandatory. If you are not able to give everything that the school is asking you to give, you can give what you are able to give. If you are not able to give anything now, you may not give anything now. You just focus on preparing your child for back to school, utilizing your resources to buy what you need to buy for them. And you can work out your arrangement if you plan to give but not now. Talk with your principals. They are able to assist you in that regard, but we are saying government workers are not government workers. There is no mandatory fee at our high school or primary schools. This is a public education system, and we are providing the grants to operate our schools. We are fully aware at the ministry that many schools would have expanded their curriculum. They're offering far more enrichment areas, and so that will attract a cost, and that is shared with parents and partners like past students and so. If it is, however, that you are not able to, parents, please don't feel that you must and don't keep the children at home because you can't. Go and talk to your principals. They understand the policy of the Ministry of Education. If it is that you are denied, talk to us. Call your regional offices and we will provide you with some support by dialoguing with your principals on your behalf.
Okay, Dr. Troop. So for the schools in the rural areas who do not have a school nurse, will the MOEYI liaison with the Ministry of Health to assign community health aides to assist these schools? So will you liaise with the Ministry of Health to assign community health aides to assist the schools?
Okay, that's a very good question. So yes, we have been working with the Ministry of Health, and they have already activated and would have indicated that the health centers are willing to support our schools. All our principals have been asked to put into their speed dial, their contact list, the health centers and the key persons that will be supporting them in the event that we need that practitioner on the school grounds. So the schools are mapped to the health centers. The principals have them in their contact. The relationships are being built on the ground because we will need that kind of support going forward. We are also continuing the dialogue with our high schools. So I know it is very difficult for even some of our high schools to get some school nurses to attract them to the school system. So we also have that challenge. But our high schools are trying very hard to recruit and to retain. And under the QEC framework, those practitioners can become available to support the neighboring primary schools if need be. It's a partnership. It's a new demand on the system, and so we have to pull on all our resources. So our high schools will stand in support of our primary schools within their quality education circles. Our health aides, our health centers, they are fully aware of what needs to take place come September, and they are willing and ready to support.
Okay, and what about the students who never got a chance to do the grade 3 diagnostic test?
As it relates to the national assessment, parents, don't be too worried about those. As I said, we are able to take some decisions concerning those. So if we had made a decision prior to cancel, nobody will be disadvantaged by that. We will regroup and we will indicate to you how we will progress in terms of the placement of those students. Remember, I said earlier that we are going to be issuing some diagnostic assessment activities in September. That information will be used to inform the planning going forward as it relates to the teaching and learning engagement for those students. So please don't be worried right now about those assessments that are in the past. We have tools put together for September, and we are able to modify the national assessment going forward to make sure that no child will be exposed to any questions or tests, for that matter, that would be looking at areas that they have not covered under the curriculum.
And I also want to assure parents that homeschooling will be provided based on assessed needs. And of course, we will provide particular support to students with comorbidities. So you can rest assured that students who have comorbidities who will have to stay home, the Ministry of Education, Youth and Information will also support those students through the homeschooling option. All right. Dr. Benjamin wears several hats, and I did mention that she is the National Mathematics Coordinator, and I just want to hear from her a little bit about the specifics in terms of the support for students who might present with the learning gaps as it relates to mathematics.
Okay. Well, we, the members of the National Mathematics team, have been supporting the process of developing those diagnostic tests that Dr. Troop has been speaking about. And in fact, we will provide significant support to the secondary schools for the development of the instruments for grades, for students who are going to be in grade 10 and 11. It's going to be important that that information be utilized, and so members of the coaches, we have currently 100 coaches deployed to the system, and they will be integral to the analysis of that data. So while it will be important at the school level, it will also guide the coaches in terms of the support that they will provide to teachers and to students. We are now in discussions to ensure that the coaches can continue to support our schools from a remote standpoint. And so we have over the years developed models that allow us to work with small groups of students that need particular targeted support, and that will continue. So once we see the results of the diagnostic tests, we will be able to help each school review the curriculum in terms of whatever gaps need to be filled. We'll provide support for teachers in terms of strategies for that, but we will also provide support in terms of pull-out sessions, even if it has to be done remotely, for students who will need additional foundational support so that they can prepare to access the next level of the system.
Thank you, Dr. Benjamin. Of course, the National Parenting Support Commission really encourages that homeschool partnership. And this it also includes participation in the PTAs, your local PTAs. We continue to work with the PTAs. We try to break down the technical information and give to you in a way that everybody is able to understand, so that, of course, we can all make the right decisions for our children. So we want to encourage you to get in touch also with the teachers. Make sure that as you plan for school, you also plan to increase that relationship and improve the relationship between you and your child's school. Make sure you know how to get in touch with the principal and your child's class teacher, so that if your child has something that you need to advocate for, then you can do so. But you can't do it if you're not involved. Don't just stay home and complain or complain to your friend. Talk to the teachers, talk to the PTA, and see how they can also help to advocate on your behalf. All right, so let me see if another question. What about private preparatory schools? Will they be getting assistance and monitoring by the MOE?
Yes.
Oh boy.
Yes, all educational institutions will be supported in terms of monitoring. We have a responsibility. Our private schools are also a part of the quality education circles. And so we have education officers who are responsible for their supervision to provide guidance. Also, our independent schools unit, we have officers in that unit who will provide supervisory support for our private institutions. The Ministry of Health will also be doing announced and unannounced visits at those institutions. As I said, the protocols cannot be compromised, and so the Ministry of Health has a duty of care to make sure that all is well and that our students are safe. So they too will be out into the field to provide guidance and to make sure that the protocols are being observed. Our education officers at the regional level and in our independent schools unit will provide supervisory support for our private schools.
Is there any support for transportation, Dr. Troop?
As it relates to transportation, we do in the Ministry of Education have a rural transportation program for students on PATH. And so selected schools would have been granted some amount of funding to support those students going to and from school. Our schools are already aware of this. Funding would have already been provided to some schools. Some schools would not have utilized all the funding from last year. And so they will begin their preparations to make sure that these students are supported going to and from school. So transportation funding will be provided to some of our schools under the rural transportation program. And these students on PATH will be supported to going to and from school under that program.
All right, and I want to also just say hello to those persons who are on YouTube. I gather we have a growing number of persons on YouTube. Please send your questions in as well. We have a lot of participation through our Facebook page. We really want to thank all parents who are so interested in what's going to happen with their children that they have joined us. I know some of you might have joined us before, and here you are again. Thank you so much. We encourage you to continue to stay abreast of what's happening. I'm not seeing any new questions just yet, so we're continuing to monitor the pages, but I want to use the opportunity to just share perhaps a few more of our helpline numbers. All right, so here we go for St. Thomas, 560-9269 and 788-5409. 560-9269, 788-5409. We were very keen on ensuring that we had numbers for both providers. So one is a Digicel number, the other is a Flow number. The 788 numbers are all Flow, 560 numbers are Digicel numbers. And for Kingston, 560-9656, 788-5460. Kingston, 560-9656 and 788-5460. May I just throw in Trelawney? I'm a Trelawney girl. A very proud Trelawney girl. Every time I say that, people ask me about yam. No, I'm from North Trelawney, sea and sand. So, 560-97, oh, there go the eyes, 9736, 560-9736, and 788-5382. Trelawney people, please call the helplines. We're here to support you as well. So those are the helpline numbers. Let me get back to see what the questions are. And will there be assistance and monitoring by the MOE? That question keeps coming. Please reassure the parents, Dr. Troop, that we will be monitoring.
Yes, parents, we will be monitoring our schools. Our Safety and Security in Schools unit will be working along with the Ministry of Health, and they will be in your schools. A matter of fact, just today we had a discussion with team members from the Safety and Security unit to start pulling together their supervisory plan for the rollout. So they will be in schools. They will be in schools prior to the reopening to make sure that the protocols have been observed in terms of the physical setting up. The wash stations are installed. The safety signs are up, installed. The sanitizers, those liquid would have been provided, the liquid soap. They will be doing the checks on the isolation areas. So yes, our officers will be in the field prior to the reopening, and they will be in the field as we continue with the teaching and learning process.
Will children 3 to 5 years of age be required to wear masks for the entire day?
Well, the Ministry of Health would have indicated to us that they recommend that children 3 to 5 wear the mask. They have also said to us that our practitioners and caregivers would need to create safe spaces. So we know the children will not keep the mask on for very long. And so they must be, in the structure of the activities, time set aside for a little break, but it must be in a safe space. The students should be spaced with the 6 feet, 3 to 6 feet distancing, limited by the number of adults. They should be assigned to the same persons throughout the day, not many persons interacting with them. So those kind of guidelines would have been sent out to the system. And so, yes, they should be in their masks, but it can be monitored. Safe spaces can be created where they can have a break. But the Ministry of Health has said that what is most important is that they protect themselves. So all the safety precautions must be practiced. If they're going to take off the mask, they must be at least 6 feet apart. Once they are not wearing that mask, they must be at least 6 feet apart under supervision to have a little breather. And then, of course, they will have to put that mask back on so they can continue with their learning engagements.
All right, and I'm really not seeing any new questions. I think we would have gone through all the questions. Let me just make sure, want to ensure we have covered everybody. I want to thank, oh yes, could you shed some light on the difference between the registration and the auxiliary fees in the high schools?
Okay, so the Ministry of Education would have indicated via our bulletin that our principals could ask for a registration fee, which will cover the package concerning the new students getting into their new learning environment. In that package, you will get a number of items, your school rule, your school handbook. Some persons will get the medical form, some persons get different things. It varies according to school. It will cover their IDs. It's in some schools, it covers their medicals and so forth. So there are different line items that are included in the registration process. And so there are fees associated with some of those activities. But we would have indicated that the package should not exceed $5,000. And if it is such that those items that are services that need to be paid for, that those are identified as such rather than being included as an overall registration fee. So there are some fees that our principals would have included in the package, but we have all indicated to them that we prefer if they itemize what the schools and what the parents are expected to pay for. For example, your PE gears. That's not a cost that the school can cover. That has to be procured. And so they will buy it in bulk to benefit from the economy of scale, and they will sell that back to you. Some schools will have put that in their registration package, and that is why you are seeing the exorbitant fees above the $500. Some schools would have put the ID. Some schools would have put the $5,000, sorry. Some schools would have put their badges, their crests, and so there are a number of incidentals that they would put in there. But we have all asked them to make sure that these are itemized so parents can buy according to what they can afford. So instead of putting 3 crests in a package, itemize it so parents can say, I will buy one now and I will buy the other later. So rather than having a bulk item in the package and then causing it to be more than the 5,000. And so we're asking our principal, please to be considerate. This is not a time that we want to have an extreme demand, a financial demand on our parents at this time. We're in a pandemic and persons are suffering from loss of jobs and illnesses. And so we really want to be considerate at this time. So I know my principals are listening too. So this is why we have said to you, keep the registration package within the approved limit by the Ministry of Education. Separate the items that the students will have to procure for uniformity. We know that. And our parents are reasonable. They know that they will have to buy the ID, they will have to pay for the PE gears, they will have to pay for the crest, they have to pay for the tie. Itemize these things and remove them from the registration package so it's understood clearly that it is not an excessive fee and that you're not breaking the regulations and the guidelines given by the Ministry of Education.
Is there any update regarding PE, physical education?
So I said earlier, parents, I think some parents are coming on a little later.
Yes.
So yes, the Ministry of Health would have indicated to us that physical activity is very, very important. In the same way we're teaching math and English and the sciences, we have to make sure that the students are keeping fit and active. And so, yes, physical activity will be a part of the curriculum, and it will be subjected to the same guidelines, keeping the physical distancing, reducing the sharing of implements and equipment, and making sure that students are on a rotational approach, so not everybody is out on the field at the same time. And so what it will take is real management and planning for that learning engagement. But yes, physical activity will be a part of the way forward, even during this time of the pandemic.
And Ranger Gray on YouTube is asking, will there be any plans to implement more African studies? I'm reading exactly what I see here, right? So are there any plans to implement more African studies through ebooks, such as Horus Rising and something else, books from Black Library?
Definitely, we have our civic program in our schools, and our curriculum will offer some references along that line. So we will take, for example, that reference that you have given, and we will have our curriculum unit locate it, review it to make sure that it is in alignment with our curriculum and can be incorporated in our open education resource list, and of course maybe accessed through our Ministry of Education content app. So we have actually a platform where ebooks can be accessed by our students, and so it's perhaps one that we can incorporate. So we'll have our media services unit review it and then incorporate it for access by our students.
And someone is asking, will there be persons employed specifically for sanitization within the school environment, or will staff members be responsible for this?
Well, as you know, parents, we have staff members in our schools. So our support staff members are in our school to provide for the environment in that way. So we have our janitors and our cleaners, and so those persons will continue to carry out their tasks. They may be reassigned differently now on regular shifts that they're not accustomed to because of the pandemic. But yes, there will be staff members in our schools to support the sanitization activities.
And someone is asking me to repeat the numbers for St. Thomas. So here we go, 560-9269 and 788-5409. And of course, the first one was Digicel, the second Flow. And these days we put 876 before all numbers. I want to just thank my small but hard-working team who have just been feeding me with information. Garland McDonald all the way in Trelawney, and Walter Dunbar in St. James, and Omar Marston, who is somewhere in St. Mary, ensuring that I have the helpline numbers the moment you see the questions on YouTube. Thank you so much for the support. And of course, Colleen Brown and the entire JIS team for just being so kind. The entire JIS is here, but they're socially distanced. There's nobody known by JIS. But thank you so much for the support. And of course, the wider Ministry of Education, Youth and Information, of course, the NPTAJ. There's just been so much support for back to school. And this is what we want, everybody coming together for this important initiative to ensure that our children they feel supported, you know, yes, going back to school. They too need to know that we're covering all the bases. And by the way, don't just ask questions. You might have suggestions too that we have not thought of. Please feel free to sending those suggestions. We want to make sure that we're covering everything, and there might very well be areas that we have not thought of because we're not perfect and we don't claim to be, but we also know that with the partnership with you on board, we'll be covering more. And the likelihood of us having issues will be limited because we're partnering in this way. So I really am heartened. I want to thank you so much. Christina Donaldson, I want to thank her as well for just being there. Are you Christina? Yes, Christina is around that side, right. And here we go again. Are we off? No? All right. So the electricity has gone, but we're still here.
Yeah.
And we can see. All right. So Dr. Troop, let me see. There's another question coming again. We did cover the diagnostic test. Maybe you just want to repeat for someone who might have come on. So we're in the dark. The electricity went, but we can see. And I'm told we're still streaming live. So Dr. Troop, maybe you want to repeat the question about the diagnostic test.
Right. So parents, as I said earlier, we will be supporting our teachers to make sure that the necessary assessment, wow, it's back. The light is back. So parents, we will help our teachers to prepare the assessment tools. We will help our teachers to administrate those tools, to analyze, and to prepare the learning plans for the students. So we will be in the field helping out with our assessment activities to make sure that we capture the level of learning that would have taken place during the emergency remote teaching, and perhaps the gaps that we would need to identify now so we can put the remedial activities in place. And of course, you will hear from your principals. Some principals will say to you, we will retain your children after school for a particular period of time. Those learning engagements will still continue, of course, in a safe environment. So what needs to be done will be done in dialogue with you, and of course, making sure that there is no compromise on safety. And of course, we continue to work with the NPTAJ. We meet with them. So I'm encouraging our parents to get involved in your PTAs, visit your school, talk to your teachers, find out what is going on, get involved in the WhatsApp groups. There are teachers who have extended themselves to a WhatsApp group. You know, there are many ways. Look at what is happening with virtual space now. We are using it to do everything. So you may not be physically at a school to check in, but you can check in virtually. Arrange with your principals to have a conversation virtually and be involved. We need you. The NPTAJ needs you. So get involved, parents. We need you on board. Just for our parents to know, too, that in addition to the fact that we are communicating with you like this, we have also been doing so with our teachers right around the island. A number of empowerment sessions are taking place. In fact, I had 2 today. And so we are talking with our teachers as well, and we are getting ideas from them. And I'm pleased to inform you also that we're planning to engage our students. So we will have some empowerment sessions coming up in August. Our youth division is planning that. And so we will be sending out the information very soon to let you know the sessions that we'll be having live with our students, and students from at our level can log on to listen to ask your questions under your guidance for the babies. So we are also engaging everyone, every key member of the school environment. Ladies and gentlemen, we have sought to engage. So our students will be engaged. We'll try to show some short videos that will be out in social media for them to be reminded of what to do, the importance of the protocols. Our tertiary institution engage, our parents engage, our teachers engage. It's an all-inclusive approach as we prepare for the 2020-2021 school year.
And another form of engagement is trying to find out what exactly the curriculum aims to achieve. So ask the questions, what should my child be learning at this time? That's an important question. And how can I assist in that process? Remember, parental involvement is wide. And I want to reiterate that you don't have to go on the physical plant to be involved, but parental involvement is key. So here's another question about extracurricular activities. Will those continue?
Yes. Our principals under the National College for Educational Leadership, they are going through a series of training now to look at how they regroup and recondition and reform to ensure that the extracurricular activities will continue in a safe way. So some of these activities will migrate to the virtual space, while others will continue physically, of course, observing the precautions. So they may not be able to meet as regularly as they would have done so under normal circumstances. But our principals, as soon as we settle school in September, treat with the assessment instruments, develop the learning plans, and know exactly the pathway for each child, we will focus now on reactivating the clubs and societies and the extracurricular activities. So again, the phased approach will be utilized. We have to settle some things first, test the systems in place, adjust them to keep everybody safe, and then we will continue to roll out the other activities.
If you're a parent who lives in Westmoreland, you're feeling stressed, you have anxieties, you're unsure about what needs to happen, you don't know where the support is going to come from, may I encourage you to call 560-9314 or 788-5568. These are the numbers for parents who live in Westmoreland. All our persons who respond to the helplines have been trained in psychosocial first aid. They're there to help you. They will provide the answers. We will guide you through whatever it is that you're experiencing at this time. Please feel free to call our helpline numbers. And if you're in St. James, you might want to call 560-9336 or 788-5276. Of course, Portland, such a beautiful parish, and you might not be as stressed because you have the natural beauty, but then you might be stressed too. So if you're in Portland and you want someone to talk to just to help you at this time, 560-9215, that's your number. The other is 788-5323. Please call us. And ladies and gentlemen, it seemed like we had a lot of time. We started at 6:30 or thereabout, and we said we'd have been here for 2 hours. We are just about at that mark. It's now 8:23, 7 minutes to go. I just want to sum it up now. And to encourage you to send your questions. Should we have missed any? I don't think I did. But should we have missed any of your questions, you can call a helpline. Call the National Parenting Support Commission, 967-7977. Visit the regional office. We have 7 regional offices now. Okay, so visit the Ministry of Education's regional offices, and I'm sure somebody will be more than happy to assist you with whatever questions you have or concerns, okay? So please feel free to call or to pay a visit. I am Casey Akar, and I remain committed to ensuring that the parents get all the support they need. Back to school is usually a stressful time anyway. Coupled with the pandemic, I can imagine that your stress levels are very high at this time. But we're here to say to you that there is help. We're here to support you. We have the NPTAJ. They will forward whatever it is to us as well, because we have a good relationship with the NPTAJ and the local PTAs. We want to ensure that you get the support you need. The National Parenting Support Commission is a unique entity because we are primarily here to ensure there's parental involvement, but we also coordinate a whole lot of support for parents. So if you're having trouble with or difficulty accessing a school or accessing the services at a school, or there's some things you don't quite understand as it relates to education, or even these plans for back to school, there might be something that was said today that you felt was a little technical and you're not quite sure what it means. Call us, because that's why we're here. In fact, may I just say that one of our policy goals is to ensure that we communicate in a way that everybody understands. So we're not afraid to be flexible with language, okay? I speak 3 languages: English, Patois, and Street. How about that? So yes, I'm that cool. So you can call us and we'll be able to sit down and just discuss whatever issue, just make sure you're understanding fully what we're trying to communicate. I think the big takeaway is that we really do care. We honestly do. At the end of the day, we're just teachers, you know, and I don't know a teacher who doesn't care. We're the Ministry of Education, Youth and Information, and we're here for you. We love our children, really. one of the things COVID did was just to expose how hard our teachers work. And when persons were saying, oh, a principal is riding his bike to wherever and so on, but we were just sitting because teachers go the extra mile every day. This is what we do. We do it without fanfare. And we do a lot away from the spotlight. There's so much that we do that goes unnoticed, and we do it delightfully. We don't complain because we understand that there really is a greater calling on our lives. Yeah. And so we try to serve the way I believe Jesus meant for us to serve. And yes, it might not be, or it might be a little taboo, but I still want to push that important thing, that spirituality at this time, that too is important. So when everything else fails, we must have hope. And a part of what that relationship with the Heavenly Father does, it gives us hope. So I believe that we're going to plan, and then we're going to pray, and together we will do what's best for our nation's children. I want to thank you so much for having joined us on YouTube and Facebook. And for those of you who I know are already dialing the helpline numbers, thank you so very much. We don't have all the answers, but I'm sure we know where to find them. Have a really good evening. Continue to keep safe. And wear your mask now, wash your hands, yes, sanitize. And let's all try to just do the best we can at this time. Have a really good night. Thank you so much.